Welcome to Music and Medicine on Monday, a collaboration between the School of Music and the College of Medicine here at the University of Iowa. This podcast is designed to help musicians play and to stay healthy. Today's podcast focuses on therapeutic use of music for people who have Parkinson's disease. This video is supplemented with more detail online through the Iowa Protocols, a free medical website. You can find that resource at the QR code or website address displayed. We're coming to you from the recital hall in the beautiful Voxman School of Music here at the University of Iowa. My name is Harry Hoffman. I'm a physician at the University of Iowa. Our featured guest today is Sun-Ju Lee, a doctoral student in music therapy. She plans to join the faculty at the University of Missouri at Kansas City after graduation from the University of Iowa this spring. And I think has a very interesting story to tell about how she came to this position. Do you want to tell us about yourself?
Sure. Thank you so much for having me this afternoon. My name is Sun-Ju Lee. I am a PhD candidate in music therapy at the University of Iowa. I originally came from South Korea to study voice at Arizona State University. During my first year as a voice graduate student, I struggled with performance anxiety, which led me to experience some back pain and digestive problems. This kind of experience was not quite pleasant. Then I decided to go back to Korea without completing the program. Then I talked to my mom, and then she was asking me, why don't you find some ways to be more proactive to manage your symptoms? And why don't you take a music therapy class, hoping that you can find some strategies to manage your symptoms? At the time, I was a pretty good daughter, and I listened to her. The decision that I made to take a music therapy class has been totally changed my whole life. Learning music therapy gave me a chance to see music as not a source of fear or pressure, but as an healing agent that can foster healing harmony inside of myself. Then I really wanted to become a music therapist so that I can share this positive experience with someone who are in need. Since 2008, I have worked as a board-certified music therapist, focusing on working for people with neurological disease, specifically people with Parkinson's disease. Currently, I am working as a music director of tremble clefs, a choir for people with Parkinson's disease, caregivers, and their family members in Arizona and Iowa. Especially the Iowa tremble clef is very special for me because I was able to start this group when I am studying my music therapy here at the University of Iowa. I am very grateful the fact that my great mentor, Dr. Abby Drorek, is going to continue this program, and they are going to flourish to help people with Parkinson's disease when I am graduating.
Can you talk a little bit more about the performance anxiety and some specific strategies that you developed from being an expert in music therapy?
As a performer, as a singer, I always wanted to be perfect. But learning music therapy helped me realize making music, enjoying music is not showing myself as a master of singing. It is all about enjoying the process so that I can grow with that experience. And learning music therapy helped me to come up with the strategies to understand my mind and the connection between mind and body so that I can practice and enjoy my singing in a better ways so that I can feel the moment that I am enjoying as a singer.
And then you share that with other people, don't you?
That's what I wanted to do. And then that's the beginning of my story with Tremble Clefs, a choir for people with Parkinson's disease.
So it's my understanding that music therapy can be applied to many of the problems that patients with Parkinson's disease have. But today we're going to focus a bit more on the vocal strength and vocal control, and perhaps have future sessions that could address some of the motor problems, even cognitive problems, and even dementia that can go along with it. Our guests today are from the music therapy area in the School of Music and Communication Science Disorder at the University of Iowa. Louise Pinkerton is a clinical assistant professor a speech pathologist with joint appointments in the Department of Otolaryngology, as well as the Department of Communication Sciences and Disorders. And one of her specialties is speech therapy for people with Parkinson's disease. Abby Dvorak is an associate professor and director of music therapy at the University of Iowa. Abby is the dissertation advisor and research collaborator with Sunju and is studying benefits of therapeutic group singing for patients with Parkinson's disease. Kate Gefeller is professor emerita in the School of Music and the Department of Otolaryngology. Kate was the director of the music therapy program prior to retirement, and she continues to conduct research in the Department of Otolaryngology. With that, Sunju, do you want to talk about the performance that I understand it's not just you, but we all are going to do in the course of participating?
Sure. Today, I want to invite you to kind of experience some aspect of using therapeutic group singing for people with Parkinson's disease. So I am going to be demonstrating how we use singing as a therapy to address specific needs in speech and voice for people with Parkinson's disease.
Great. Well, I look forward to participating. This will be wonderful. So Sunju, I understand that you treat patients with Parkinson's in several different ways, usually in a group setting. Can you discuss about how you interact, maybe the duration of your sessions? Do you ever do one-on-one, and how long it lasts when you're working with these different groups?
Right. When I am having a small group of people, our session goes about 45 to 50 minutes. But in the setting of therapeutic group singing with treble clefs, we usually go about 2 hours. And we just want to make sure to include the time for the socialization so that they can benefit from this group as well to enhance their psychological aspect with living with Parkinson's disease.
So we'll have a relatively small sampling, maybe 5 minutes or so,
yes,
of your interaction. Can you describe how you get the patients with Parkinson's better?
Yes. So in the music therapy setting, I set up a goal specifically to help them to improve their volume, enunciation. Also, we try to have them to enhance their mood and create a space, safe space to make socialization. So for 5 minutes that I am having this afternoon, I am going to just show a little bit of vocal exercises and how we use as a music therapist to use singing as a way for them to meet those specific goals.
And I understand you're going to ask us to participate.
Yes, that's the plan. So in order to increase the active participation, as a music therapist, we choose the songs in a very careful manner. We ask our participants to share their preferred songs and their favorite songs and familiar songs so that they can contribute more. In that way, we can increase the participation. Ultimately, we can enhance the overall quality of outcomes. So as a way to show you to do some breathing exercise to enhance the volume of speech, I always ask them to start with some breathing exercise. Why don't you take a deep breath into your nose. Breathe in, 2, 3, 4. Exhale to your mouth. 5, 4, 3, 2, 1. Very good. And usually I said, why don't you put some smiles on your face? Because one of the symptoms of Parkinson's disease is flat affect, which means they're having a trouble to put some facial expressions on their face. That's one of the symptoms. So that we are inviting them to enjoy the atmosphere of making music with their friends, and probably according to the lyrics of the song, we're having them to be more expressive, to change their facial expressions. So I'm inviting you to think of something make you feel really happy. Then inhale and exhale with this gentle sound. Are you ready? Take a deep breath in. 2, 3, 4. Hold and Are you smiling? Let me see your smiles. Thank you. Now I see your smiles. Let's do one more time. And inhale. 2, 3, 4, and exhale. Very good. Now Now, why don't you enjoy the moment you are making that beautiful, gentle ah sound? Smiling, helping you to lift up the back of your throat so that you can resonate your voice like you are singing in a beautiful cathedral. So now, think about the structure, the back of our throat, and now we make ah sound all together. 1, and breathe in, and ah. And then the ah sounds goes to ooh. Here we go. Ooh. Wow, that's beautiful. Now let's use the sound for singing. We have You Are My Sunshine. You are my sunshine, my only sunshine. You make me happy when skies are gray. You never know, dear, how much I love you. Please don't take my sunshine away. Please don't take my sunshine, breathe away. Wonderful, very good. Let's take a deep breath again. Another big ah. Ah. Now, I need you to elongate this sound, especially when you're making ke, sera, sera. We're going to elongate the the vowel sound. By doing so, you are going to be noticing you need extra strength, extra power from your breathing muscles to project the sound. So it goes like this. Ke, sera, sera. 1, and now you go. Ke, sera, sera. When I was just a little girl, I asked my mother, what will I be? Will I be pretty? Will I be rich? I did the says to be ready. Go. Yes, Sarah, Sarah. Whatever will be. The future's not out to see. Yes, Sarah, Sarah. More breath. What will be, will be. Back to Kesera. Kesera, Sarah.
Sanju, sometimes I have trouble holding my breath. Would it help me to put my hand here on my abdomen, or how do I help to keep that breath going?
That's a very good question. What can you do? Just like you said, you can put your hands on top of your belly button. And when you're inhaling, feel the expansion. And feel the expansion from your rib cage. And use the power to produce the sound so that you can project your sound further. And in that way, you can make your voice more healthy ways.
Okay.
Thank you. Do you want to try?
Yeah.
Okay. Now we have an easy song to sing along. Take Me Home, Country Roads. This time, I want to invite you to take an opportunity to share your voice with your friends. At the end, I'm going to be asking you to sing a solo. A little bit short. Harry, don't be surprised. Very short.
But I want you to keep going.
Exactly. Take a deep breath. It's all about exercising our breathing muscle through singing.
Do my shoulders go up and down?
Just make sure you're not raising your shoulders when you're singing. Okay. So by giving a gentle pressure to your abdominal muscles, you can lower that pressure. So we are not going to be engaging any secondary muscle tensions from our throat, from our shoulders, and our chest. It's all about using your belly energy. Okay, good. Take me home, country roads, to the place I belong, West Virginia, Mountain Mama. Take me home, country roads. your voice. Country roads. Woo! Yay! Now, we have another one called Sweet Caroline, right? I want to invite you to engage your breathing muscles like this. Bum, bum, bum. Can you project your sounds farther? Bum, bum, bum. So when we sing right after, Sweet Caroline, bum, bum, bum. I want you to make sound like more drumming. Bum, bum, bum. Maybe if you want, you can move your arms so that you can kind of direct your sounds farther. It's all about projection. You know, try? Sweet Caroline, bum, bum, bum. Good times never seem so good. So good, so good, so good. Very good. Are you ready? Okay. 1, 2. Take a deep breath, some smiles. We can do it. Here we go. Sweet Caroline, bum, bum, bum. Good times never seem so good. So good, so good, so good. I've been inclined, hey, to believe they never would. Sweet Caroline. One more time. Sweet Caroline. Very good. Now we have the final exercise. More than 70 people with Parkinson's disease experience some type of speech and voice difficulties, such as swallowing problem as well. Now I am going to introduce you one simple voice exercise you can practice swallowing. When we are swallowing, our larynx goes up and down. It will make a really automatic upward and downward movement. But when we're using sound like this, ee-ha, we can have the similar sensation from our throat. When we're making this E sound, the larynx goes up as the way it goes up to protect the airways. When we say ah, it goes down and then going back to the relaxed position. So I'm going to invite you to take a deep breath. But the thing is, if you don't take a deep breath, you can make this E-ah sound. You cannot really hold the E sound in a longer manner. So make sure, breathe and project, then E-ha. How fun way to exercise swallowing by making this sound.
This is like we're cowboys.
Exactly.
Okay.
So show me what you got, Kate.
Yee-haw.
Very good. Did you engage your breathing muscles?
Let me try it again.
Yes.
Yee-haw.
Very good. How about you, Harry?
Yee-haw.
Wow, sounds like a real cowboy.
Sounded like a real
cowboy. How about you, Abby?
Yee-haw.
Wonderful, Louis.
Yee-haw.
Wow, right? Very good. She has a wonderful way to support her breath so that her sound is really well projected. Very good. So if we want to have a better onsetting of our speech, you always want to be aware of taking a deep breath and just try to spend plenty of time before you're speaking. For people with Parkinson's disease, they are really getting stressed about making a conversation in a loud restaurant because they are really afraid of making sound in the public setting because they're anxious about taking enough time to breathe and speak. For Parkinson's, they need extra time to process. So it's okay for you to retrain your brain. Okay, put more intent, breathe in, more breath, and project. We're going to wait for you, and then our brain is going to be retrained that way. Okay, so we're gonna be singing a very interesting song. She'll be coming around the mountain when she comes. Ee-ha! Okay. I'm gonna practice my ee-ha. Ee-ha! You can make some changes, the way you make the E-ha sound goes up and down so that we can practice intonation as well. Okay. She'll be coming around the mountain when she comes. Yee-haw! Wow! She'll be coming around the mountain when she comes. Yee-haw! She'll be coming around the mountain. She'll be coming around the mountain. She'll be coming around the mountain when she comes. Yee-haw! Wonderful. Very good.
That was terrific, Sanju. That was really nice. Abby, do you want to make some comments?
Yeah, that was beautiful, and it was so engaging. And you might have noticed all of us were smiling and very excited to participate as well. And so if you think about those are songs that are familiar to many of us. They're songs that, in case of Take Me Home Country Roads and Sweet Caroline, those are very preferred pieces of music. They might have a lot of memories that are positive associated with them. We have a change and a shift in mood that might occur in our emotions and how we feel about ourselves and our environment and our world. It also is a great way to have a lot of repetition of these vocal exercises. Through music, it might not seem as strenuous if we do things 16 times versus if we did them without music, it might be a little bit more taxing, or we might not have the motivation to continue as much. So putting all of these vocal exercises in music and related to things that are preferred for people, I think is really wonderful. And you do such a nice job engaging all of us in different ways, doing some music, teaching some skills and practicing some skills, and then having us try them out in different ways. My favorite, though, is implanting swallowing exercise in Yee-haw. How fun is that? And there's so many country songs where we can practice that, and it was just really a wonderful, wonderful job.
Great. And so, Louise, as a speech pathologist, can you comment on how your approach may differ, but also integrate the work that Sanju did?
Yeah, well, certainly in speech pathology, we use singing because it's a great way to get people more engaged in what they're doing physically, and you've got all those other things you were talking about. Our approaches, we have two really highly researched programs called LSVT Loud and Speak Out, both of which I am trained in, so I want to disclose that. And our focus there is really you pick one thing to think about and you make that your target, because we want people to be deliberate about what they're doing. So for LSVT Loud, the idea is we want to recalibrate where people think their loudness is, and the basic idea is do more, be loud, until that feels normal. And then they'll talk loud enough that other people understand them.
Louise, can you talk a little bit about, you're talking about being loud, but why is that important? What are some of the changes to the voice in Parkinson's that makes being loud so important, which it is?
Absolutely. One of the big things with Parkinson's is you end up with people that you can't understand because their voice gets very soft. It gets to us mumbled. It can get slurred together because people are talking faster, where you can't pick out what the different words are, so you can't figure out what they're saying. Their voice quality can also get worse. And we don't hear rough voices as well as we hear clear voices. So we've got all of those things happening, subtle in the beginning, but getting worse to a point where I saw a patient in her last days in the hospital for acute care that I had worked with earlier, and it was at a point where I couldn't understand her. I knew her, I had worked with her, and it couldn't get anything out of what she was saying because it was so soft and so muted. And so what we need to do is get the person physically doing more. And you have to think about doing it on purpose, because part of what the problem is with Parkinson's is the automatic aspects of speech and movement don't work as well. They're turned down. So if we go to a different way that our brain works and we try and do something on purpose or deliberately or intentionally or musically, we get better voice production. And we found that high intensity, high effort works. So really, this isn't like where you go do speech therapy for a year. It's really built around 4 weeks where you come in 2 to 4 times a week and you do these intensive sessions. You practice multiple times a day, and then you keep doing that forever, which is what I hate when physical therapists tell me, just go do your exercises. But people that keep practicing daily, take part in a weekly voice group to check in, join things like choirs, and do other big voice activities, can maintain their voice. So not only sometimes getting back function, but they can avoid having it get worse as they go on. And Sanju really made a point of talking about socializing and interactions, and I hear that so much. I go to my men's coffee and no one will talk to me. I go out to dinner at a noisy restaurant and my grandchildren won't talk to me. My kids yell at me on the phone to talk louder, but I'm doing everything I always do. And so people's lives can become very small. And then you think about healthcare. What happens in healthcare when your providers can't understand you? And as a society, we have a really hard time asking people to repeat things more than once or twice. And then we start smiling and nodding. And that would be a horrible way to live, knowing the world is just smiling and nodding at you. So we know it makes a huge difference to people to have those interactions, to have those activities to do, to be heard again.
I've also heard that depression is not only part and parcel to feeling isolated, but that may also be related to the disease process itself. Mm-hmm. And so emotions and emotional well-being is an important goal for people with Parkinson's disease, I believe.
Yeah, people's emotions are very up and down. I've had people that, like, in the middle of the session, we start talking about grandkids, and they're in tears. And it's not because it was a really big emotional moment, but because just their emotional regulation isn't as consistent. So all of those together really come to play with emotions. And also, being an able-bodied person that's having difficulties, that's a hard change. And it's inevitable for all of us, but it's really apparent with Parkinson's. So people are going through this change of who they are, how they respond because of how the brain's working, and then lack of social interactions. So challenging.
Is a prescription from a physician necessary for music therapy to be covered by insurance, or is there some realistic, real-life problems with getting this kind of treatment to everybody? Have you encountered that, Sanju?
Unfortunately, music therapy is not really well covered by health insurances. So there are some movements going on to make it happen. But when we are going back to the conversation about the emotional challenges and different depressions, what I have experienced, 80% of singers that I have in treble clef have reported that I am dealing with anxiety, depression. And I was very curious about the aspect. Then, after years of experience, I realized when you're dealing with lots of problems, physically, your voice gets smaller. You cannot do something you used to do. That makes you feel very upset. And they are very anxious about tomorrow. What can I do tomorrow? I have a big appointment tomorrow, but what if my voice is not working? What should I do? If I am having a trouble with walking, am I able to get to the appointment? So they are very anxious about their future. But we are using as a safe outlet for them to be more expressive, or somehow provide a way for them to accept their physical or psychological or any chronic illness, the condition, so that they can still have the hope and the focusing on the maintaining their quality of life. I think that's what we are doing in the music therapy setting.
And if I can just add to that too, we know that we're dealing with the whole person, right? We take a very holistic view that biological, psychological, and social aspects of functioning all interact with and affect one another. So if somebody has a lot of biological things happening, like this reduction in dopamine and so forth, that's going to affect things like learning, memory, movement, or has the potential to affect those things, and also mood. And so that also can affect our socialization. If we don't feel good or we have all of these difficulties communicating, that is going to affect how we feel and how we socialize with others and interact with our world. So everything is somewhat connected, because then if we have this low mood, we don't socialize with people, how do we feel biologically, physically? We feel perhaps more fatigued, or we notice our problems more. So there really is this interconnection between all these systems. Yeah.
It seems to me that one of the things too about your group, first of all, you're serving many people at once, and they understand each other's situation. So I think they can give good advice to each other. I also think one of the things about the tremble clefs that's wonderful is you involve the spouses or significant others. When people have a chronic illness like this, I would say the family suffers from that chronic illness. And there are very important things that get learned and practiced in a one-to-one session. But I think with these groups, it also provides the caregivers or support system some hope, and they get a chance also to share ideas and learn from other people. And I think that's a really big part too. I've known people who are caregivers of individuals with PD who said their lives got very small, and they no longer had the social life that they used to have. So I think that whole part of it being also support for the person who's going to have to be their advocate, I think that's also really, really important. And the singing feels very normal. It doesn't feel like, okay, I'm doing an exercise here. It feels very normal. And some of these people, in fact, probably have been parts of their church choir, or they've been part of a community choir. So I think it makes them feel more like they're doing something that is regular, that they used to love to do before they started to have Parkinson's symptoms.
Right. You really pointed out a very important aspect of the establishment of tremble clefs. The tremble clefs was established in 1994 from a Parkinson support group. They get to meet once a month to share information about Parkinson's disease, and also the caregivers are invited. And they usually finish their meeting with group singing. What they found when they are driving back home, the caregivers has noticed they are engaging in a very fun conversation with their loved one with PD, because their voice gets to be more stronger, and then they're enunciating the words clearly so that they can enjoy the conversation. Then they decide to meet weekly so that they can continue singing and help their loved one to improve their voice.
And I think that's huge, because many people, as you said, Louise, don't necessarily want to go back and do practice exercises and go back to therapy. But if they're finding that it's enjoyable and it feels normalizing, I think they're more motivated to keep showing up and to be part of the process and to provide support for each other.
Yeah, absolutely. And Speak Out does have a formal singing program. They have songbooks they've put out. They did a production of a musical with a choir. I mean, it was on stage, but like a choir that looked like it was probably 200 people. They did, Peter Pan. So we had these older adults doing the roles and doing the choral work. It is so valuable to feel like you're doing something normal. And running back to the insurance issue, I think another reason this is so important is that insurance doesn't cover speech group activities. So we can get coverage for the individual treatment, that's not a problem. We can get coverage for our check-in sessions. But when we get to that weekly speech group, or we get to the choral or music therapy singing, insurance isn't going to pay for that. So it's very important that we have so many resources and options, and the fact that music therapy can do this and you have people that are experts in music make that a really great partnership to the whole treatment process.
I'm sort of curious, maybe among the three of you, you could talk a little bit about the overlap and the unique differences between speech practice, and then what do you see as the music adding to that? Or are there some aspects of how you choose the music or how you set it up that might enhance the process?
Many times speaking and singing have overlapping neural pathways. But some of the activation patterns are different. So whereas speech is many times processed in the left hemisphere of the brain, music might be processed throughout, and on the right hemisphere of the brain. So music can be processed in many different ways and formats. what we can do is we can help support some of the speaking exercises through music, and through the repetition, the preference, we start to activate all these other neural networks in the brain too, not just those involved speaking. So we have, the improved mood, we have the socialization that can happen, and the improved quality of life overall. We also have a very important that reward and motivation piece that can happen, which keeps us attending therapy and keeps us engaged throughout the process.
Yeah. And I think with speech therapy, or really voice therapy, it's not a very good name for what we do, by the way. I do the whole gamut, from the quietest talking you can do to people doing performance voice. And the difference for me is I'm going to be thinking about how the voice functions and what do I want them to do with the singing voice or the speaking voice, or how does singing help them do more with their speaking? Or if we give them a different vowel, how does that change their singing? But my scope, even though I am a voice teacher, with speech ends when we really get into making musical choices and interpretation and correcting people's diction, unless it helps them physically sing better. So yeah, I might help people choose repertoire. I might coach them a little bit to help shape how they inflect a line, but I'm not going to get into the nitty-gritties of the artistic aspect of it. But I love using singing even with people who are not quote-unquote singers, because again, the joy and the mood and all of that, and that it's transferable. I mean, the vocal folds are the vocal folds. It's a difference between running and walking. It's the same system. You're using it differently.
There's a thing from Oklahoma, a song that goes, "The cowboy and the farmer should be friends." And I feel like the music therapist and the speech language pathologist should be friends. I love the fact that, Louise, that you have this knowledge about singing, that you are a professional singer, but and you also have this deep knowledge in speech language pathology, and that what music therapists do is not the same thing, but it's complementary to what speech language pathologists do. And I feel like really there's nobody who has the entire answer for our clients. And I think people can benefit from different things at different times.
Yeah.
That's a good summary. So thank you, Sanju, Abby, Louise, and Kate for sharing this information on music therapy and Parkinson's disease. Additional information regarding this and other episodes of Music and Medicine on Mondays can be accessed by visiting the Iowa protocols through the QR code displayed, our website address, or by searching on the web for Iowa Protocols Music and Medicine on Monday.
You are my sun.